okay. Good evening, ladies and gentlemen. Tonight we are at Al Asil Greenacre for an event hosted by ALMA, which is the Australian Lebanese Medical Association, in honor of our Lebanese minister, which is Dr. Firass Abiad, who is on a diplomatic trip to Australia in order to discover many ways of collaboration between Australia and Lebanon in the sector of health, of course. And next to me, lucky me, having His Excellency. Welcome to Australia.
Thank you.
Is it your first visit to Australia?
Yes, it is.
Oh, well, welcome, much welcome. I hope we are hosting you well as the Lebanese community. So as we said that you are here on a diplomatic visit in order to collaborate with Australia for the health sector. What are your objectives of this visit?
Yeah. So there are several objectives. The first objective, I must say, is to meet our diaspora and to acknowledge all their support that they have been giving to Lebanon across the years. As you know, Australia hosts a large Lebanese diaspora community, and they have been extremely supportive even before the crisis, but especially during the crisis, to their community and to their family and so on. The other objective is I am participating in the Global Health Security Conference that is being held in Sydney. This is the first time this conference is held since COVID started, and as you know, after COVID, global health security has become a big issue. We're seeing that these viruses don't respect borders, and therefore we need to work collectively to be able to create a safer environment, a healthier future for our countries and our communities. And the only way we could do that really is to work together. I think it's very clear that we can collaborate with them in supporting our health sector. So I started my visit in Melbourne, where we visited Monash University, and we are also in collaboration with the Australian Lebanese Medical Association, ALMA. We've had several meetings with people involved, and we're talking about projects with them to support our public hospitals, especially cardiac services, and also about looking at distance support systems, especially for remote areas. We know there's a lot of areas in Lebanon where, unfortunately, we've seen migration of healthcare workforce, and that has made it more vulnerable. Here in Sydney, we've had several visits to different universities and hospitals. I've just come from a visit to Westmead Hospital and the Children's Hospital as well. And we've also discussed areas where we can collaborate, especially on mother and child support. We've also visited some of the pharmaceutical factories. One of the largest pharmaceutical factories in Australia, Vitex, is a company owned by people with Lebanese ancestry, and they're very keen on supporting Lebanon and supporting our industry back there as well. And we've also visited some of the aged care facilities that are present, and this is something important because we're seeing that a lot of people are leaving Lebanon, but their parents and families are still there, and we do see that there is an issue with aged care later, in Lebanon, and we want to improve the care that we provide to our community.
That is very lovely. It looks like you've been on a very long and successful trip. I salute you for that. Did these visits sound positive? Is there any successful or already ongoing projects that you decided to work on?
So I think that, and here I want to go back to acknowledging our diaspora because of their hard work and because of how well they have done in these communities. When we visit communities all over across the world, but particularly here in Australia, we see that we are given, as Lebanese public officials, a red carpet treatment. There is a lot of intent and willingness to help Lebanon. I think major in a major way because of the diaspora. We've already discussed 7 different projects, and I'm very happy to say that ALMA is our trusted partner. It's very well known here in Australia as well, and we will be hoping to bring those projects that we discussed into fruition very, very soon.
Lovely, amazing. It makes us feel proud from Lebanese background as well to hear these. One last question, if you don't mind, Your Excellency. Have you had the chance, or do you have the intention to try and maybe visit our Australian Health Minister, Mr. Butler?
So I've seen Mr. Butler during the health security conference. I've also had the chance to meet with the health secretary, the state health minister in Melbourne, and we've also have seen several officials in Australia. Now this is extremely important because we also want to create an official link, intergovernmental, between the Ministry of Public Health in Lebanon and the Ministry of Health here in Australia, whether at the federal level or more on the state levels, because a lot of the issues related to hospitalization and care are done here at a state level.
Amazing. Thank you so much for your time. Thank you so much for what you're doing for Lebanon. We really appreciate that, and I'm sure you are having all the support from the diaspora as well. Please enjoy your stay in Australia, and hopefully it's not the first or the last time you do it. Thank you very much.
Thank you.
No worries. As you can hear, ladies and gentlemen, our minister is enjoying his trip to Australia and is actually having a successful collaboration already. At the moment, I will have a little talk with Mr. Paul, who is the president for ALMA at the moment, right? Nice to see you. Thank you. So tell me, how did all this come about?
So we actually had some contact through some intermediaries. We knew that the minister was coming down here for a conference, and so we were able to set something up with him in his honour, and we're honoured to have him come and be with ALMA. And it just shows that even though we are worlds apart in many ways from the homeland, they still care about the bridges that we've got between our two communities. And it's a great initiative on his part to come down here. It's not often you get a minister from the government doing the rounds. Lebanon is in a lot of need at the moment, and I think that he's taking on a lot of initiatives to try and hopefully encourage some improvement in the situation over there, and we're happy to support him in that way.
True. So you said you want to support him, and he just mentioned in his word as well that he's being in partnership with ALMA. So if you can mention just a couple of words, how do you think this collaboration, partnership or support is going to happen in the future?
There will be many avenues in which it can take place. It'll sort of come down to what requirements or what need there is from the minister and the resources that we have available.
Yeah. So really the bridge between Australia and Lebanon, ALMA will be kind of a bridge.
The most important thing is to establish connections and to keep those connections. And insofar as we can do that, we will. And then I think the building blocks after that can be varied and different and serve different purposes. So we don't have any specific equipment that we are providing at the moment or specific service, but hopefully, God willing, in the future there will be plans to provide more tangible benefits to the community over there. We're in a fortunate situation to be here, and we're happy to put our foot forward and stand up and try and help.
Amazing. You mentioned that you're trying to be, collaborating or connecting through connections. Do you think members of the ALMA, who are all of them are actually medical members, do you think they can actually help through their services or experiences from Australia into Lebanon?
Service provision is something that we do here for our community for a living. And to the extent that we can maybe, you're touching on one of the ways that we can help in the future. And so to the extent that we can help people from there understand what types of, for example, quality assurance we engage in, I think that, and the processes that we have around our healthcare system, or we can even be a lot more granular than that, just our own personal practice, that may be able to provide some help to them. And that's just an example of the plethora of things that we can touch on and expand on, and that's what we are going to explore with the Minister, and we're happy to help the community both here and in Lebanon.
Amazing. For those who do not know ALMA, Australian Lebanese Medical Association, can you tell us a little bit of who you are, what you do, when do you meet, just for us to know more about you?
Essentially, we're a like-minded group of healthcare individuals, or individuals within healthcare in Australia. We have different chapters, I guess, if you like, and we're the New South Wales chapter. And the vast majority of us are from Sydney, just because of the location. And we're not just doctors, we're allied health and nursing members of the entire healthcare service. And so we collaborate with each other and on ways to try and connect, encourage people with a Australian Lebanese background to get into healthcare, and also try and provide services that are appropriate for our community in terms of the cultural sensitivities, I guess, if you like. And we're happy to. We're Australians, so our services are obviously not just restricted to the Australian Lebanese community, and the vast majority of us have practices that service. We serve everybody, but we also have a heritage and we have an identity, and so we look to build on that in various ways through ALMA, through making sure that we keep our connections with each other. We do this through educational events, through community-facing events, and events like this where we get...
and I remember last year we had Dr. Shabal as well, doing the cardiologist, doing a workshop which we covered as well, and we were there. So things like that you do kind of...
we have a lot of strong members in the community, people who are well respected, people who have a lot of understanding of how to get the message out to people about healthcare and how to look after themselves and their families, and we look to build on that. And hopefully the fruit that we are, the seeds that we're planting here will develop for some future generations to continue.
Of course, it's already showing. Thank you so much for your time today, Paul. I'm looking forward to talking more with you guys and the way you serve the community. So thank you very much. As we can see, ladies and gentlemen, so the Minister and the President for ALMA have been doing a great job trying to collaborate together. We've got another interview today. Please come through. Hello.
Nice to meet you.
Nice meeting you too. Please tell me, what's your name and what do you do?
So my name is Noor Ibrahim. I'm a medical student at the University of Sydney.
Oh, nice. Yeah, one of the new generations.
Hopefully.
Sure. Are you part of ALMA?
Yes, I'm on the student subcommittee.
Oh, nice. So they have a subcommittee for...
So there's 3 students on the subcommittee, and we're looking to grow the Lebanese community across medical students and encourage the new generation of doctors and pharmacists and health professionals.
So what was the major that you're doing again?
So my undergraduate degree, I did science, and now I'm in my 3rd year of medicine at Sydney Uni.
Lovely. And what are you looking forward for tonight's event?
I'm just looking forward to networking with everyone and talking to the health minister about the health problems that are facing Lebanon, and looking at growing our objectives for ALMA for New South Wales.
That's true. We do have a lot of conflicts in Lebanon, as we all know. Were you able to have a little chat with the minister yet? Did you talk about anything that you'd like to share with us?
Yeah, we spoke to the health minister about the main pressing issues in Lebanon, medicine shortages in Lebanon, and obviously the political crisis at the moment, and how it's affecting the health of the Lebanese community and the broader diaspora.
And how do you think ALMA can help with the shortages of medicine? The very first thing that everyone asks about.
Honestly, just raising awareness. That's something that we will discuss with the health minister later.
True. Do you think we can send any medications from overseas, like from here all the way to Lebanon?
Definitely. I think the role of the diaspora is, of course, to raise awareness and provide as much aid as possible, and we have been doing so and continue to do so.
Lovely. We are so proud of you already. So thank you so much for being here, and thank you for your input. Have a great night. No worries. All right. Next, we have another interview. Hello. What's your name? Shaza? Shaza. Okay. So tell me, Shaza, what do you do and why are you here tonight?
I'm actually a pharmacist.
Oh, are you?
Yes.
I'm originally one. Don't tell anyone.
Oh, that's good.
Just I don't know how many millions are watching us. Okay. So tell me, so you've graduated from Australia?
Yeah, I've been practicing for about 10 years now.
Oh, lovely.
Yes.
Do you have a practice of your own?
No, I work in another pharmacy, but I've got my own side thing. I do my own skincare brand as well. So
lovely.
A few things happening at the same time.
Of course,
yes,
empowering women. Lovely.
Yes.
So tell me, what are you looking forward to tonight?
Actually, just networking, discovering what there is out there in terms of the relationships. I think it's very important for our community to get together. I don't think there is enough of it. It's really great that we can have the Lebanese minister visit us in person, and just getting everyone together and seeing what opportunities can arise from these events to also help our homeland as well.
That's true. Did you have a chance to speak to the minister already?
I did. He's
Can
lovely.
you tell us a little bit what happened in that conversation?
We actually he spoke about his specialty, and we spoke a bit about medication, the medicine shortages. I mean, as a pharmacist, I totally understand the situation, the generic substitutions. So yeah.
Speaking of that, we just had the same conversation before you. So do you think we can actually do something, maybe send some medications in a legal way, have a kind of a collaboration between Australia and Lebanon? And
why not? I think this is why these events are very important, because this is how you establish, you get to know people, what's out there, and it's all about networking.
100%. Yeah. Thank you so much.
No, it's lovely.
I already love you. No worries. Have a great night. All right. As you can see, a lot of medical, of course, come through. Hello. What's your name? Tell me.
Nada, how are you?
Nice to meet you,
Nada
Nada.
Makikani.
What do you do?
I'm a speech pathologist.
Speech pathologist.
Yeah.
Nice. So
Thank you.
tell me, what are you expecting from tonight's event?
Look, it's wonderful to catch up with like-minded colleagues, and it's great to meet the minister from our country. So yeah, very excited to see colleagues again. It's a great meeting spot.
Lovely.
Yeah.
Have you had a little chat with our minister already?
I have, yes.
Yeah.
It was great because I could speak in English. I mean, obviously we mix it up.
Yeah,
but he's
of
great. It's really good. It's so nice to see him.
Of course, we are looking forward as well
Thank you.
how pathologists can help, speech pathologists,
Yeah.
of course, can help between Lebanon and Australia. How do you think you can collaborate?
You know what? I've been thinking about this for the last few days, especially when there's been some trauma-related events. We're always happy to sort of collaborate and share with our colleagues over there in terms of how to check for tongue ties, how to, from lactation, so from breastfeeding in babies all the way through feeding and communication difficulties. We're actually always travelling, working with dentists closely as well. So I would love to be able to go to Lebanon soon. I haven't been there in 20 years.
Oh, wow.
I know.
Nice.
So hopefully one day, and I'd love to be able to collaborate with colleagues as well.
Well, we're looking forward to that collaboration.
Thank
you
you.
so much for your
Likewise.
time tonight.
Thank you so much.
Enjoy it. No worries. As you can see, ladies and gentlemen, a lot of medical staff, medical members from all, departments of medicals, looking forward to meet the minister and speak to him. Hello, come through. So tell me, what's your name and what are you doing here tonight?
I'm Eli Sawan. I'm a cardiothoracic surgeon, originally from Lebanon, but now I'm working here in Sydney.
Lovely. Was it plastic surgeon?
Cardiothoracic.
Oh, wow.
Heart surgeon.
Heart surgeon. Wow, lovely. So tell us, did you have the chance to meet our minister tonight yet?
Yes, definitely. But I didn't have the chance to have a chat with him. But definitely we'll have a
What are you looking forward to hear or talk about tonight?
Well, first of all, we need to get news for him, like about the general situation in Lebanon and what's the health care system now. What's happening in Lebanon. As we may know, like after the crisis that had happened, all has collapsed. So what's the solution? If there's any solution, any remedy, or any options for the Lebanese people?
Do you think you have any options or ways to help?
Well, where we can help is we still have family back in Lebanon, and we really care about them. So what we really care, which we need to brainstorm all of us. So if we can help with the minimal things, that may have a big impact on them.
Lovely. Do you have your own surgery in Australia?
Yes.
Whereabouts is it? Tell us.
Yeah, I work in Westmead Hospital, the Children's Hospital in Westmead.
Nice.
Yeah, so mainly I'm involved in cardiothoracics and all the open heart surgery for the kids.
Lovely meeting you tonight. I hope you benefit from tonight, and let's see how collaboration can go.
Nice
Thank you. Wow, that is amazing, collaboration and meeting lovely medical members. Hello, how are you? Good. Tell me, what's your name and what do you do?
My name is Serge Gira. I'm a neurology fellow, so final year trainee at Macquarie University Hospital in motor neuron disease.
Wow, lovely. And what do you think you can benefit from tonight?
So tonight's dinner was basically to extend our discussion. So at ALMA, we do a lot of advocacy, health advocacy, and we have done previously a lot of charity with Lebanon, especially after August the 4th and during the economic crisis, which is still going. So we wanted to, work on further avenues to work on with Lebanon. I mean, we all have sort of ties. A lot of us visit. A lot of us came from Lebanon. So, we just want to continue doing that.
Lovely. Do you have any success stories that ALMA actually did help in the past?
Yeah. So 2 years ago, ALMA Victoria was helpful in securing a lot of medications. There was medication shortages. People had the money.
Talking about it now.
And then we also sent a few ECG machines, so heart monitoring machines to some of the hospitals after August 4th. And there was an exchange doctor from Westmead who went, ICU doctor who went down to ALMA. We are not directly dealing with charity per se at the moment, but this is why tonight was a very important meeting.
Yeah. Having the minister with us tonight, he did mention that he is looking forward for a lot of partnership and collaboration with ALMA. How do you think you can help in the future?
Definitely. So I think there's a lot of ways. So there's avenues of education. There's probably avenues of exchanging expertise and maybe even knowledge. I mean, obviously, this will depend on security in Lebanon, all of these things. But also there would be just establishing the connections, knowing how to do things. Australian hospitals. Australia is one of the top 10 healthcare places in the world, so it's very important to do that and to give back to the energies back to Lebanon and all. And I think there will be a lot of avenues from that point of view. We haven't talked about it yet tonight, but hopefully it will be fruitful.
Of course. Thank you so much for your time. Lovely meeting you. I hope you enjoy your evening.
Thank you.
No worries. All right, and still waiting for another interview. Hello, how are you? Come through. Please tell us what's your name and what do you do?
I'm Josie, and I am the secretary of ALMA.
Oh, nice.
Yeah, so I have been for the last, 5 or 6 years. And
Lovely. So, as we were talking before, ALMA's trying to collaborate with the Minister of Health in Lebanon to see how we can help the crisis. From your position, how do you think we can do that?
Well, I think speaking with the minister briefly, education is really important, so that people over there can be informed about, different
awareness.
Yeah, raising awareness of different conditions and how best to manage those conditions is a really big thing. And also the minister's been here, looking at different hospitals and the way things have been run over here as well. So maybe helping contribute in that way, so we can translate some of our experiences here and lessons learned to the situation in Lebanon.
Lovely. It's nice to hear that it's not only through in-kind, donation or sponsorship. Of course, we do send a lot of money and a lot of products, but it's nice to see that we're sharing knowledge as well.
Yeah. So that's a big part of our organisation, is sharing knowledge to not only health professionals, but just the general public and the community, so that they can make the best decisions about their health. And, prevention is better than cure. So that's a big part.
That is lovely to hear from you. Thank you so much for all what you do at ALMA, and thank you for this event. Enjoy it. No worries. As you can see, ladies and gentlemen, we did have a little talk with some of the attendees tonight. A lot of health professionals, as we mentioned, Ahi, alongside with the Minister of Health. We are looking forward to what he's going to talk about tonight and how we can collaborate.